I'm most excited about offering this to our patients who have active cancer, who are in remission from cancer, and the benefits of high-dose IV vitamin C minimizing their side effects from their chemo. The reason high-dose IV vitamin C is so fantastic for people that have cancer is because normal cells have peroxides in them. Catalase is an enzyme that breaks down peroxides in normal cells. Well, cancer cells have 10 to 100 times less catalase. So when you give high-dose IV vitamin C, you make peroxide, and then those cancer cells are rusted and destroyed from the inside out. So you can see that high-dose IV vitamin C is absolutely outstanding for patients with cancer. Well, I'm 61 years old, and I really didn't step my feet in the water of functional medicine until closer to 12 years ago on my own journey, and then opening the practice 10 years ago this year. And you know, those age spots, people call them age spots or liver spots, you just add vitamin C and it'll make your skin glow. So just for beauty and a skin glow, you don't have to have cancer. You don't have to have POTS. You don't have to have SIRS. You don't have to have chronic fatigue and all these other things to get it. You could buy a 4-pack and do it for the glow that the vitamin C is going to impart on your beautiful body, and also take those aging and liver spots away. If a person has a lack of a certain enzyme called G6-PDH, their red blood cells can break open. That's called hemolytic anemia. So first of all, we need to do that. We also need to make sure that a person doesn't have a history of kidney disease or congestive heart failure, or the degree to which that is present. High-dose IV vitamin C can lead to the precipitation of calcium oxalate crystals. So we want to be very, very careful in certain patient populations. And so we've developed these screening protocols, and it's not just a one and done. You want to ramp up so the bad cancer cells can die, or just have the benefit of high-dose IV vitamin C to kill infections in your body. You don't receive the maximum benefits of high-dose IV vitamin C in lowering inflammation in your body. So this has to do with something called oxidation and reduction. You want to replenish what's missing in the body. So that's why we don't do a one and done. We want to provide people with the maximum benefit. Because there are rapid shifts in electrolytes and minerals and vitamins in the body, sometimes you can develop tetany. Have you ever woken up in the middle of the night with a foot cramp? Okay, where your foot is spasmed. That's called tetany. So when you're receiving that, that can happen. So we add in calcium gluconate. The other thing is because it's very acidic, it goes into sterile water. And we buffer that. It's pre-buffered so that it doesn't sting really bad. This is such a therapeutic infusion, and it also augments chemotherapy. We want people, we partner with the integrative oncologists and MD Anderson here at Hope for Healing. We're in Houston, for Pete's sake. So that can help minimize the side effects of chemotherapy. Chemotherapeutic agents can damage the heart, and high-dose IV vitamin C offsets that. And so we love it. We love it. Vitamin C resembles glucose. And because of that, when you have a high amount of a hexose ring, resembles glucose in your bloodstream, you get a lot of water following that. So there's shifts in electrolytes in the body. And so in the bag of the vitamin C, we put calcium gluconate, which helps with any potential cramping, but we also have minerals in there to replete that. So you might drop your blood sugar during the infusion, and that's why it's absolutely 100% necessary that you've had that meal so that you don't drop your blood sugar, become very shaky and hypoglycemic. I went to a standalone place several years ago. The nurse didn't know this. No one told me I had to have a meal, and no one could explain why I was shaking. And I went home and shivered under the covers for like 2 hours. And they didn't tell me why, they didn't prepare me. It was so sad. So we're not going to allow that to happen to our patients. And we want you to also bring along some high protein snacks, like boiled egg, avocado, chomp stick, that kind of a thing, nuts, just to kind of keep that going. If you have a continuous glucose monitor and you have metabolic syndrome, you might have an artificial escalation of your glucose, and that's because the glucometer is reading the hexose vitamin C, the little ring in your. There's a ton of literature showing the benefits. When I first heard of IV vitamin C, it's like you wonder, well, is it orange? Is it yellow? Does it look like sunshine? What does that feel like? And why would I put vitamin C in my body? Well, years ago, Linus Pauling published a profound amount of research on vitamin C, and he was spot on, and he won the Nobel Prize in Medicine for this. And then there's documentation for this. And so it's so encouraging to see what's out there. And if you just open your eyes to the benefit of that, and I think that if a doctor with the plethora of literature that there is to support this doesn't agree with that, then you need to find a new doctor. It's like open your eyes and see the benefits for your patients. So really, really excited about this.